When patients come into our office for emergency treatment or have a severe problem, most of them think that it just happened overnight. That's usually not the case. It's usually over a period of time. They've seen dentists, they stopped seeing dentists, they took 5 years off. Oftentimes, a lot of my patients, because the average patient in my office is 64, the new patient, they'll come in there having seen a series of dentists over the period of their life. They may see a dentist and do like $5,000 or $10,000 worth of work, and then they'll go for a while, then they stop going, or they have a bad experience, they go elsewhere. Most of them come in here broken, not trusting anybody. Similar to addicts. I call it the sonic curve. When people are born, they usually are born with relatively good teeth, and over a period of time, the teeth get worse, perhaps. They'll do a two-surface amalgam or two-surface bonded restoration, then it'll become a crown, then it'll become an extraction, then it'll become a bridge, then it'll become a multiplicity of bridges, then it'll be another extraction, then it'll be an implant, then periimplantitis, and periodontal disease, and on and on and on. Now, this is not for all patients, but it's for a lot of the patients that I see. Their experience with dentistry and their experience with their teeth has not been really positive. So when a patient comes in, I tell them that they are sort of like addicts. And what happens with addicts over a period of time, whether the addiction is food, whether it's drugs or alcohol or sex or gambling, or in my case, the respectable addiction, work, over a period of time, it gets worse and worse and worse until they hit the bottom. And there's a curve that was developed by Dr. Jellinek. He was a professor at Yale in the early part of the 1900s. And he said that over time, addicts get worse and worse and worse until they hit the bottom of that curve. And that bottom of the curve, they'll spiral. And a lot of people will stay there and they'll just have a miserable life until they die, or they'll die, or they'll go to jail, or they'll go into a hospital. And after I saw that curve, I started to think about our patients. And a lot of my patients are at that bottom of that curve. Nothing works. They'll come in with 3 or 4 teeth or a broken partial denture. And these are patients that have means. They just never really got the care that they needed. And so they don't trust anybody and they feel hopeless. And I tell them, I say, we're going to get you healthier. I go, but you've come here. And when someone comes into my office, they're ready for help. They've asked for help. They're ready to take that first step. That first step is like an admission, like I have a dental problem, I need some help. And when they come in, they may not trust me right away, but they're ready. And I tell them at that first visit, I'm glad that you came here. I realized the hardest thing you did was get in that car, drive to my office, and walk up those steps. And for every 6 or 7 patients that are referred, only one makes an appointment. By the time someone comes to see me, they've been referred to me or somebody like me many times. By their friends, by the butcher, by their dentist, by their primary care physician. They finally come in, they're sort of ready to begin treatment. So at that point in time, I tell them we can move you back up the curve. And how do we do that? By educating them. And we take baby steps. I said, first we're going to control the infection. We're going to get you out of pain. That's so important. And then we'll start to rebuild things. So by doing that early on in the game, by telling a patient how I'm going to take them through that, there are a couple of things that I do. I tell them about the 4 phases of care. I tell them about the 5 ways to do it. Let me talk about those briefly. We've talked to them about them in the past, but I cannot mention this enough because we all learn this stuff in dental school, but I am blown away by how few of us remember this. It starts with an examination. When the patient comes in, I say, we're going to do an exam, and then I'm going to give you a diagnosis. Everybody in the world should have the same diagnosis for that patient because there's only one true diagnosis. Whether it's caries, periodontal disease, whether it's a lung infection, whatever it is, pneumonia, that's the diagnosis. And then here's where it differs, the treatment options. There are many different treatment options for your diagnosis, and then I give the patient the options, and then we do treatment. And then I tell patients about that before I even begin care. I say, you're in the right place. We're going to do an exam, and I'll give you a diagnosis, and today I'll give you some treatment options. We're probably not going to do any treatment unless you have an acute painful situation. We'll treat that. And then I say, we're going to treat you this 5 ways. First, I'm going to get you out of pain. If you're not in pain, we don't have to do that. 2, I'm going to control infection. 3, we're going to do functional rehabilitation. That will be crowns, surgery, implants, ortho, etc. Then we're going to do aesthetics. And then the most important phase is the maintenance. I tell them all this before we begin treatment. So during that first visit, that's a very important visit, I try to inspire trust, but I tell them what we're going to do. Most dentists don't do that. Most dentists say, that's an implant, that's a denture, you need Invisalign, you need this. We go right to the treatment. That's not a good way to inspire trust. because most of these patients don't trust us. And why should they? They've got nothing but pain and suffering out of going to a dentist. It's not always their fault. Sometimes it's the dentist's fault. Oftentimes it's both the dentist's fault, the patient's fault, and sometimes just bad luck and having bad genetics. It's a combination. But here's the good news. Today we have the technology to get every patient healthy, and if we educate them and teach them what needs to be done. And I think it's a privilege, and it's also our responsibility. So next time a patient comes in looking terrible, don't blame the patient. Empathize with them and offer them some hope and offer them a way out, because they've made the biggest important step, and that's actually walking to our chair, which is not an easy thing to do for most patients. Be the gift to your patients, and have a great day, everybody.